Welcome back. We'll start with a new topic, dengue. Dengue fever is a self-limiting disease caused by dengue virus, or also called as arbovirus. So this virus will cause the dengue. This is a virus looks like, and it has viral genome, nucleocapsid, M proteins, and viral envelope. This is the structure of dengue virus. Is a single-stranded RNA viruses that belong to the family Flaviviridae and the genus Flavivirus. Single-stranded RNA viruses that belong to the family Flaviviridae and the genus Flavivirus. So this is the uh, RNA virus, only single-stranded RNA virus and belonging to the family Flaviviridae and genus Flavivirus. The vector is Aedes aegypti and Aedes albopictus. That is the mosquito. Aedes aegypti. The symptom may be asymptomatic or may lead to classical dengue fever or dengue hemorrhagic fever with shock or dengue hemorrhagic fever without shock. This is the main disease or a symptom which caused by the arbovirus. That is dengue fever or dengue hemorrhagic fever with shock or dengue hemorrhagic fever without shock. These are the three types of fever which will be caused by the arbovirus. So what are the dengue syndromes? It is a manifestation of dengue virus infection. First, it is asymptomatic, and then there is symptomatic. In symptomatic, again, it is of three types: undifferentiated fever, dengue fever, and dengue hemorrhagic fever. And dengue fever is further classified as without hemorrhage and with unusual hemorrhage. And dengue hemorrhagic fever is classified again as no shock and with shock. Dengue hemorrhagic fever with shock. Classification: WHO classified this dengue fever into two groups, that is severe and uncomplicated. Severe dengue is defined as the one that is associated with severe bleeding, severe organ dysfunction, or severe plasma leakage, while all other cases are classified as uncomplicated. Okay? This is the very serious case when there is a bleeding, organ dysfunction, and plasma leakage. If there is no this symptom, then it is not complicated. The prevalence of Aedes aegypti and Aedes albopictus together with the dengue fever virus tends to be associated with the outbreaks. Okay. If there is any Aedes aegypti or Aedes albopictus mosquito, and again if there is any dengue virus, combinedly they will spread the dengue. There will be outbreak of the disease. And the epidemiological determinants: agent. The dengue virus belongs to the distinct complex within the genus Flavivirus based on the antigenic and biological characteristics. So, due to the antigenic and biological characteristics, this dengue virus is or arbovirus, which will be coming under the genus Flavivirus. There are four virus serotypes which are designated as DNV1, DNV2, DNV3, and DNV4. Infection with any one serotype confers a lifelong immunity to that serotype. If this any serotypes infects you again and it is treated, then lifelong you will never get this infection. Vector: Aedes aegypti and Aedes albopictus are the two most important vectors of dengue. This is the mosquito which transfers the virus. Both the mosquitoes carry vectorial competency for dengue virus, that is high susceptibility to infecting virus, ability to replicate the virus, and the ability to transmit the virus to another host. Okay, it will get infected. It will replicate in the virus will replicate inside the mosquito body. Then it will transmit the virus to the another host. Aedes aegypti is a highly domesticated, strongly anthropophilic nervous feeder. It bites more than one host to complete one blood meal. Okay, nervous feeder means it will never feed on one subject. Okay, one person. It will bite to every like multiple person. And the dengue symptom is high fever, headache, muscle and joint pain, pain behind eyes, skin rashes, vomiting, and bleeding from mouth or nose. This is the main symptom of dengue. And transmission: Aedes aegypti mosquito becomes infective by feeding on a patient from the day before onset of the fifth day, that is viremia stage of illness. Okay, the patient got infection and he is on fifth day. And when the mosquito bites, it will get infected, or the virus load will occur in the mosquito body. Then it will bite. If it bites to the healthy person, he will get the virus or infection. After an extensive incubation period of 8 to 10 days, the mosquito becomes infective and is able to transmit the infection. Okay? After the incubation period, that is 8 to 10 days after the bite to the infected person, then it will become infective to transport the infection. Once the mosquito becomes infective, it remains so for life. Okay, lifelong it will be infective, that mosquito. So how the dengue transmits? Uninfected mosquito will bite the infected person who is infected with the dengue. Then it will remain incubation period in 8 to 10 days, and when it bites to the healthy person, he will get infected. So what is the life cycle of dengue virus? Mosquito feeds on viremic human. After 10-day extensive incubation period, virus passes from intestinal tract to the salivary gland. Human infection from bite, that is when the mosquito bite, he will get infection. Mosquito remains infectious for life, that is 1 month. Can transmit infection with as few as 100 viral particles. Okay, around 100 infection it can occur. So, dengue virus belongs to the Flaviviridae, 40 to 5 nanometer sphere, lipopolysaccharide envelope, and 4 stereotypes. The genital tract of the mosquito gets infected, and transmission of dengue virus occurs when enters fully developed egg at the time of oviposition. Okay, even if it is laying egg, that eggs will be get infected. Then the born mosquito will be infective. So environmental factors. The population of Aedes aegypti fluctuates with rainfall and water storage. Its lifespan is influenced by the temperature and humidity. When there is optimum temperature and humidity, there will be growth of the Aedes aegypti. The mosquito survives best between 16 to 30 degrees Celsius and a relative humidity of 60 to 80 degrees. It breeds in the containers in and around the houses. In this type of container, it will be growing, so you should not store this type of water. Whenever you see this, you should destroy it. Wherever this Aedes albopictus breeds, that is tree holes, rock pools, cocoa pots, vehicle tires, coconut husks, bamboo stumps, and sauces under the plant pots. Being a domestic feeder, it is a endophagic and endophilic. So this is the life cycle of the Aedes mosquito. Aedes mosquito, after 2 days, it will have a blood meal, then it will lay egg, then it will become larva, then it will become pupa, then into the Aedes mosquito. This is what larva looks like. You should destroy the larva by introducing the gambusia fish in the water tank. The failure of urban authorities to provide civil amenities and poor public health infrastructure raises the potential for the vector to breed at high level and makes the environment transmission unconducive. So the corporation or the municipality, they should take care of the water storing area so that there will be no growth of the mosquito, and thus it will reduce the prevention will take place. The mosquito will not breed, so that there will be no dengue infection. Factors for epidemicity of dengue: strain of the virus, which strain the mosquito is having or the person is infected, the density, behavior, and the vector capacity of the vector population. So the vector, whether it is able to carry the virus, whether it will feed or multiplication can occur or not, this everything matters here. The susceptibility of human population, the interaction of virus into the receptive community. Whether the human population is infect, sorry, immunity, that means immunized means he got the infection before and now he is immune. having immunity. So whether they have the immunity or not, the when the virus is introduced in the community, whether it will be infective to the everyone. High risk patients are infants and elderly, obesity patient, pregnancy and peptic ulcer diseases. So this diseases whoever is having, if they get infected, they will be in they it is very dangerous for them. Women in menstruation who have an abnormal bleeding, hemolytic diseases, congenital heart diseases, chronic diseases, and patient on steroids. So this is mostly based on the bleeding, and the clotting factor will be reduced. So this will be very dangerous for these patients. And clinical manifestation. Dengue virus infection may be asymptomatic or may cause undifferentiated febrile illness, that is viral syndrome. That means there is fever. Then dengue fever will be there, dengue hemorrhagic fever, including dengue shock syndrome. These are the main symptomatics. Undifferentiated fever. Infant, children, and adults who have been infected with the dengue virus, especially for the first time, may develop a simple, undistinguishable fever from other viral infections. So, first, if the person who, infant, children, or any adult, if they got infected for the first time, then the fever, uh, the type of fever will be vary, so we can make out. Maculopapular rashes may accompany the fever or may appear during the defervescence. Okay, it may appear during the fever or later. Okay? Upper respiratory and gastrointestinal symptoms are common. There will be vomiting, diarrhea, with that. Classical dengue fever. The illness is characterized by an incubation period of 3 to 10 days. That is commonly 5 to 6 days. This is the incubation period, 3 to 10 days. The onset is sudden with chills and high fever, intense headache, muscle and joint pain which prevent all movement. Okay. When there is joint pain, you cannot move. Okay. That much pain will be there. And associated with that, there will be high fever, intense headache, and the chills. Okay. Within 24 hours, retroorbital pain, particularly on eye movement or eye pressure, and photophobia develops. Okay. After 24 hours, you will feel the pain behind the eyes, particularly during the eye movement and eye pressure, and photophobia, you cannot open the eye. Other symptoms include extreme weakness, anorexia, constipation, altered taste, sensation, colicky pain. That is, colicky pain means it, what we call when the kidney stone is there, how you will feel the pain like that. There will be stomach pain, abdominal tenderness, dragging pain in the inguinal region, sore throat, and the general depression. Fever is usually between 39 and 40 degrees Celsius. Fever is typically but not inevitably followed by a remission of a few hours to 2 days. That is biphasic will be there. Okay. 39 to 40 degrees Celsius fever will be there, and inevitably followed by a remission of a few hours to 2 days. That is, there be decreased fever, again it may start again. The skin eruptions appear in 80% of cases during the remission or during the second febrile phase, which lasts for 1 to 2 days. Skin eruptions means there will be rashes, maculopapular rashes will occur. That is during the resting period, that is second febrile phase, which will last for 1 to 2 days. The rash is accompanied by similar but milder symptom. Again, there will be same symptom like fever, anorexia like that, but it is of milder symptom. The rash may be diffuse, flushing, mottling, or fleeting pinpoint eruptions on the face, neck, chest during the first half of the febrile period, and a conspicuous rash that may be maculopapular or scarlatiniform on the third and the fourth day. There will be rashes. Okay, those are type of rashes like diffuse, flushing, mottling, and fleeting. It may occur on the face, neck, or the chest, and it is present in the first half. In the second half of the febrile period, there will be a conspicuous rash, that is maculopapular rash will occur, that is little higher elevated form, or scarlatiniform in the third or fourth day. Starts on the chest and the trunk and may spread to the extremities, rarely to the face. It may be accompanied by itching and hyperesthesia. There will be little loss of the sensation. The rash will last for 2 hours to several days and may be followed by desquamation. Okay, there will be peeling of skin. Desquamation means peeling of the skin after the rash occurred in the skin. Fever lasts for days, rarely more than a week, after which recovery is usually complete, although convalescence may be protracted. Okay. Fever lasts for about 5 days, that is more than a week, rarely more than a week, after which recovery is usually complete. Okay. Afterwards, they will recover, although convalescence may be protracted. They will be sometimes they will be again uh, fever may come. What are the danger signs of dengue infection? First is bleeding. For example, red spots or patches on the skin, bleeding from nose or gums, vomiting blood, black colored stool, heavy menstruation or vaginal bleeding. So this is the bleeding. Okay, under bleeding it comes. Then frequent vomiting, severe abdominal pain, drowsiness or irritability, pale, cold or clammy skin, difficulty breathing. These are the very dangerous sign in the dengue infection. Fever lasts for about 5 days, rarely more than a week, after which recovery is usually complete, although convalescence may be protracted. We have seen this already. And there are three phases of the dengue fever: febrile phase, critical phase, and recovery phase. In the febrile phase, you will see sudden onset of fever, headache, mouth and nose bleeding, muscle and joint pain, vomiting, rash, and diarrhea. In the critical phase, you will see hypotension, decreased BP, pleural effusion, there will be fluid collection in the pleural cavity, ascites, again the water collection in the abdominal cavity, uh, peritoneum cavity, gastrointestinal bleeding. Recovery phase, altered level of consciousness, seizure, itching, slow heart rate. So this is the symptom in the three phases. Treatment: there is no vaccine or specific medication. Seek medical advice, take risks, drink plenty of fluids, that is ORS, fruit juice, kanshi, rice water, anything. Take paracetamol to reduce the fever and joint pain. Aspirin or ibuprofen should not be taken. DHF, that is a dengue hemorrhagic fever, is a severe form of dengue fever. The course of dengue illness can be divided into three febrile phases. That is febrile, critical, and recovery phase. What we have seen already: febrile phase, incubation period is incubation of 4 to 6 days, and illness commonly begins abruptly with a high fever, accompanied by facial flushing and headache. Anorexia, vomiting, epigastric discomfort, tenderness at the right costal margin, and generalized abdominal pain are common here. During the first phase of the illness, usually resembles classical DF, that is dengue fever, but maculopapular rash, usually rubelliform type, is less common. Okay, maculopapular rash will occur, that is in the rubelliform type. This is the dengue rash, what we are seeing, the reddish color. It may appear early or late in the course of illness. Occasionally, the temperature may be 40 degree to 41 degree Celsius, and febrile conversion may occur, particularly in infants. Okay, in infant, because of fever, there will be sometimes fits, that is convulsion. Positive tourniquet test is the most common hemorrhagic phenomenon. When you tie the tourniquet, you can see there will be uh, like light pale color than around skin. Okay. The test is performed by inflating a blood pressure curve to a midpoint between systolic and diastolic pressure for 5 minutes. The test is considered positive when 10 or more petecia per 2.5 into 2.5 centimeter are observed. Okay. When you do that, if there is presence of petecia, that is a reddish discoloration in the skin, then it is a positive factor. In DHF, the test usually gives a definite positive with 20 petecia or more. In the DHF, you will see more than 20 petecia. Critical case: around the time of defervescence, when the temperature drops to 37.38 degrees Celsius or less and remains below this level, usually on days 3 to 7 days of illness, an increase in capillary permeability in parallel with increasing hematocrit levels may occur. Okay? There will be capillary permeability, increased capillary permeability, and increased hematocrit level. Hematocrit level means there will be a destruction of the blood cells. This marks the beginning of the critical phase. The period of clinically significant plasma leakage usually lasts 24 to 48 hours. Because of capillary refilling, permeability increase and hematocrit level increase, there will be plasma leakage. Progressive leukopenia followed by a rapid decrease in the platelet count usually precedes plasma leakage. There will be decreased platelet count, which will prevent the clotting, so there will be plasma leakage. At this point, patient without an increase in capillary permeability will improve, while those with an increased capillary permeability may become worse as a result of loss of plasma volume. Okay? If the capillary permeability is okay decreased, then there is no problem. If it is increased, there will be plasma leakage. The degree of plasma loss varies. Pleural effusion will be there, mostly on the right side, and the ascites may be clinically detectable depending on the degree of plasma leakage and the volume of fluid therapy. Okay? Based on the fluid therapy and the plasma leakage, you can see the ascites and the pleural effusion. Gallbladder edema has been found to precede plasma leakage. Again, there is a edema of gallbladder. Hence, chest X-ray and abdominal ultrasound can be useful tools for the diagnosis to check the edema. Shock occurs when a critical volume of plasma is lost through the leakage. It is often preceded by warning signs or abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation, mucosal bleeding, lethargy and restlessness, liver enlargement more than 2 cm and oliguria. Okay, there will be these symptoms like clinical fluid accumulation, that is what we say in pleural effusion and ascites, and there will be mucosal bleeding also, lethargy, generalized weakness will be there, and restlessness, and there will be liver enlargement up to 2 cm and oliguria. Decrease urine. This is bleeding in conjunctiva looks like. Bleeding gums. The body temperature may be subnormal when shock occurs. Okay, even sometimes there will be no fever. With prolonged shock, the consequent organ hyperperfusion result in progressive organ impairment, metabolic acidosis, and the DIV. Okay, due to plasma leakage and hematocrit value increase, there will be less supply of the blood to the organ, so there will be hypoperfusion, and which will lead to the progressive organ impairment, metabolic acidosis, and DIV. This in turn leads to severe hemorrhage, causing the hematocrit to decrease in the severe shock. Okay, in the severe shock, again there will be increased hematocrit level. Instead of leukopenia usually seen during this phase of dengue, the total white cell count may increase in patient with severe bleeding. Okay. If there is any severe bleeding, sometimes there will be increased WBC. In addition to severe organ impairment such as severe hepatitis, encephalitis, or myocarditis, or severe bleeding may also develop without obvious plasma leakage or shock. Sometimes there will be more bleeding without plasma leakage, and there will be sometimes infection like hepatitis, encephalitis, and myocarditis. Those who improve after defervescence are said to have non-severe dengue. Okay. After defervescence, if there is an improvement in the condition, then it is not a severe dengue. Some patients progress to critical case of plasma leakage without defervescence, and in the patient, changes in full blood count should be used to guide the onset of the critical phase in the plasma leakage. So after the critical case, some patient may progress. Some patient may progress to the critical case of plasma leakage without defervescence. Okay, there be no any other conditions, defervescence, the fever or anything, and changes in full blood count should be used to guide. Okay, WBC or platelet, everything will be changed. So this will lead the laboratory investigation. Those who deteriorate will manifest warning signs. This is called dengue warning sign. There will be warning signs when the patient deteriorates. Cases with dengue warning signs will probably recover with early intravenous rehydration. When we get warning signs, if we start the hydrating the patient, he will get okay. Some cases will deteriorate to severe dengue. And the recovery phase, the patient survives the 24 to 48 hour critical phase. A gradual reabsorption of extravascular compartment fluid takes place in the following 48 to 72 hours. If the patient survives in the critical case or critical phase, he the whatever leaked fluid or the extra compartment fluid will be reabsorbed back in the next 48 to 72 hours. General well-being improves, appetite returns, gastrointestinal symptom abate, hemodynamic status stabilizes, and diuresis endures. There will be normalizing of every body function. Some patients may have a rash of isles of white in the sea of red. Okay, that is all over the body. It looks like reddish color, but in middle there will be whitish patches like structure. There will be no bleeding, so that is called isles of white in the sea of red. Some may experience generalized pruritus. Bradycardia and ECG changes are common during this stage. The hematocrit stabilizes or may be lower due to the dilution effect of reabsorbed fluid. Hematocrit stabilizes later. WBC count starts to rise soon after defervescence, but the recovery of platelet count is typically later than that of WBC count. First, WBC count will be normal, then the platelet count improves. Respiratory distress from massive pleural effusion and ascites will occur anytime if excessive IV fluid have been administered. Okay, the patient is already having pleural effusion and ascites. If you give again IV fluids, there will be more respiratory distress. Often due to fluid therapy, pulmonary edema or congestive heart failure may be reported during the treatment. Congestive heart failure because of the increased fluid volume. Severe dengue. If the person is having plasma leakage, that may lead to shock, severe bleeding, and severe organ impairment. He will be known as severe patient. As dengue vascular permeability progresses, hypovolemia worsens and results in shock. It usually takes place during the defervescence, usually on day 4 or 5 of illness. The condition is preceded by the warning signs. So you will know the warning signs, you can start the treatment. During the initial stage of shock, the compensatory mechanism which maintain a normal systolic pressure also produces tachycardia. So there will be systolic pressure, you can see. Again, there is tachycardia, peripheral vasoconstriction with a reduced skin perfusion. Okay, blood supply to the skin is reduced. So there is cold extremity and delayed capillary refill time. Unequally, the diastolic pressure rises towards the systolic pressure and the pulse pressure narrows as the peripheral vascular resistance increases. When the PVR increases, there will be a diastolic pressure increase, again pulse pressure also increased. Patient in dengue shock often remain conscious and lucid. Inexperienced health personnel may measure a normal systolic pressure and misjudge the critical state of the patient. Okay, when the patient, dengue patient is there, you should see the systolic and diastolic BP properly. Otherwise, you will misjudge him. Finally, there is decompensation and both the disappear abruptly. Prolonged hypertensive shock and hypoxia may lead to multi-organ failure and an extremely difficult clinical case. Okay. If there is multi-organ failure, it is very dangerous sign. Patient is considered to have shock if the pulse pressure is less than 20 mm of Hg in children, or he or she has signs of poor capillary perfusion. So that means he is in a shock. In adult, if it is below 20 mm of Hg, may indicate a more severe shock. Hypertension is usually associated with a prolonged shock, which is often complicated by major bleeding. If the hypertension is there, again major bleeding, again it is a complicated condition. Patient with severe dengue may have coagulation abnormalities, but these are not sufficient to cause bleeding. What are the criteria for clinical diagnosis? Probable diagnosis, that is acute probable illness with 2 or more of the following, that is headache, retroorbital pain, myalgia, arthralgia or bone pain, rash, hemorrhagic manifestation, leukopenia, thrombocytopenia, rising hematocrit. If there is any condition is there, then it is termed as he is having the dengue. And at least one of the following: supporting serology on simple serum sample, that is titer is more than 1280 with hemagglutinin inhibition test. Comparable IgG titer with enzyme linked immunosorbent assay. If there is any one, you can confirm it as a severe case. or testing positive in IgM antibody test occurrence at the same location and time as confirmed cases of dengue fever. Confirmed diagnosis is by isolation of dengue virus for serum, CSF or autopsy sample. Fourfold or greater increase in serum IgG increase in IgM antibody specific to dengue virus. If there is dengue virus seen in the IgM antibody of dengue virus is seen, then again it is confirmed. Detection of dengue virus or antigen in the tissue, serum or the CSF by immunohistochemistry. Detection of dengue virus genomic sequence by reverse transcriptase polymerase chain reaction. Again, it will confirm. This is what we've seen. Dengue hemorrhage fever is characterized by all the following, like acute onset of fever of 2 to 7 days duration, hemorrhagic manifestation shown by any of the following, like positive tourniquet test, petechiae, ecchymosis or purpura, or bleeding from mucosa, GI tract, injection site or other location. If there is any bleeding, then it is confirmed. Hemorrhagic manifestation shown by any of the following that we have seen: bleeding in gums, platelet count is less than 1 lakh cells per millimeter cube, objective evidence of plasma leakage due to increased vascular permeability shown by any of the following, like rising hematocrit, or hemoconcentration is more than 20% from baseline, or evidence of plasma leakage, such as pleural effusion is there, ascites, hyperproteinemia and albuminemia. This is also confirmed. And dengue shock syndrome includes all the symptoms of diseases, including tachycardia, cool extremity, delayed capillary refill, weak pulse, lethargy, restlessness, which may be a sign of reduced brain perfusion. This is the symptoms we are seeing in the dengue shock syndrome. Pulse pressure is less than 20 mm of Hg, we increase diastolic pressure, example 180 mm of Hg. Hypertension by age defined as systolic pressure less than 80 mm of Hg for those aged less than 5 years, 80 or 90 mm of Hg for older children and the adults. This is the graphical representation here. And the laboratory diagnosis is by rapid and accurate dengue diagnosis, very important for the following reason, like clinical management and the epidemiological services, research and vaccine trials. Epidemiological surveillance requires early determination of dengue virus infection during the outbreak for urgent public health action towards the control. There will be survey. Okay, survey should be done to see the outbreak of the disease. Diagnosis can be done by virus isolation, viral nucleic acid detection, immunological response in the serological test, viral antigen detection, rapid diagnostic test, analysis of hematological parameters. Virus isolation can be done. Is possible provided the specimen is taken during the first 6 days of illness and persist without the delay. Specimens that are suitable for virus isolation are acute phase serum, plasma or washed buffy coat from the patient, autopsy tissue from the fatal case. Virus nucleic acid detection. Dengue virus genome, which consists of RNA, can be detected by reverse transcriptase polymerase chain reaction, that is RT-PCR assay can be done. Immunological response and serological test, hemagglutination inhibition test, complement fixation, neutralization test, IgM capture enzyme linked immunosorbent assay, indirect IgG ELISA, IgM IgG ratio. These are the tests we can conduct to confirm the DSS. Viral antigen detection, that is by ELISA and dot plot test. Rapid diagnostic test. A number of commercial rapid format serological test kits are present for anti-dengue IgM and IgG. However, the accuracy of these tests are uncertain. And hematological parameters, you will see the platelet count. Clinical management. It is important to classify the severity of dengue infection. The presence of thrombocytopenia with concurrent hemoconcentration differentiate grade 1 and grade 2 DHF from DF. Okay, by seeing this symptom only, you can confirm the diseases. How you will manage it? The patient who are able to tolerate adequate volumes of oral fluid and the pass urine every 6 hours and do not have any warning signs, adhere to the following criteria. So, if the patient is able to Process the fluid, then you can take adequate amount of fluids. Encourage intake of ORS, electrolyte and sugar to replace losses from the fever and vomiting. Adequate oral fluid intake to be done to reduce the number of hospitalization. Administer paracetamol for high fever if the patient is uncomfortable. The interval of a paracetamol dosing should not be less than the 6 hours. Tepid sponge can be done. Do not give aspirin, ibuprofen or any other NSAIDs. Acetyl salicylic acid may be associated with a Ray's syndrome. Instruct the caregivers that the patient should be brought to the hospital immediately if any of the following occur, like no clinical improvement, deterioration around the time of defervescence, severe abdominal pain, persistent vomiting or cold and clammy extremities, lethargy or irritability, restlessness, bleeding, that is black stool or coffee ground vomiting, non-passing urine for more than 4 to 6 hours. Patients who are discharged should be monitored daily by the healthcare providers for the temperature pattern, and paracetamol is administered to keep the temperature below 39 degrees Celsius. Copious amount of fluid should be given to maintain the fluid and electrolyte balance. Patients should be monitored for initial signs of the shock. Critical period is during the transition from the febrile to the febrile stage, and usually occurs after the third day of illness. Okay, there will be critical period during the reduction of the fever. In this time, you should maintain all the blood level and electrolyte level. You should give the adequate fluid. Serial hematocrit determinants are essential guide for the treatment since they reflect the degree of plasma leakage and the need for IV therapy. So hematocrit value could be monitored. Management of DH grade 1 and grade 2. Based on the signs, you will give them like treatment. This is the WHO classification based on the signs and symptoms. We have seen this already. The person with dengue hemorrhagic fever with the thrombocytopenia and hemoconcentration present with abdominal pain, black tarry stool, epistaxis, bleeding from gums and infection. So this is a very dangerous sign during the dengue hemorrhagic fever. All these patients should be observed for signs of shock. The critical period of development of shock is transition from a febrile to afebrile phase. A rise in hemoconcentration indicates the need for IV fluid therapy. Despite this treatment, if the patient BP falls with a decrease in urine output, the management for grade 3, 4 DHF or DSS should be instituted. Oral dehydration should be given along with antipyretic like paracetamol and sponging. How you would treat the grade 3 and grade 4? The common signs of complication are observed during the afebrile phase of the DHF. Following hospitalization, the hematocrit, platelet count, and the vital signs should be examined, and a fluid therapy can be started. Patient requires a regular and sustained monitoring. Patient has already received about 1000 ml of IV fluid. It should be changed to colloidal solution preferably. So IV fluid can be changed to the colloidal solution. That is dextran 40 per hemocil, or if hematocrit is decreasing, fresh whole blood transfusion, ml per kg per hour should be given. In case of persistent shock after initial fluid replacement and resuscitation with plasma or plasma expanders, hematocrit continues to decline, internal bleeding should be suspected. Okay. Again, if there is shock and there is internal bleeding in the decline, it should be suspected. It is thus recommended to give fresh whole blood volume. Oxygen should be given to all patients in shock. So what are the indications for red blood transmission? Loss of blood, 10% or more. Refractory shock despite adequate fluid administration and declining hematocrit. A replacement volume should be 10 ml per kg per body weight. If the fluid overload is present, packed cell are to be given. For the platelet transfusion, in general, there is no need of give prophylactic platelet even at the less than 20,000 cubic millimeter. Prophylactic platelet transfusion may be given at level of less than 10,000 cubic millimeter. Prolonged shock with the coagulopathy and abdominal coagulogram, if there is any,
you can give the platelet. In case of systemic massive bleeding, platelet transfusion may be needed in addition to red cell transfusion. How you will discharge the patient? Absence of fever for at least 24 hours without use of antipyretic drugs. Return of appetite, visible clinical improvement. Good urine output, minimum of 2 to 3 days after recovery from shock. No respiratory distress from the pleural effusion or ascites. Platelet count more than 50,000 per cubic millimeter. And the disease notification. In dengue endemic countries, cases of suspected, probable, and confirmed dengue should be notified as soon as possible so that appropriate health measure can be initiated. And control measure can be done by mosquito control, vaccines, and other measures. And the community participation, anti-odor and anti-larva measure can be done to the mosquito control. You should prevent the water stagnation in this area. There is no vaccines for the disease. Other measures is like isolation under bed nets during the first few days, individual protection against the mosquitoes. Other personal prophylactic measure and environmental measure can be done. This everything we have seen. So that's what about the dengue. We'll see in the next class. Thank you.